Thanks for the opportunity to speak. I want to make a couple points about the health department, the public health department's response to this situation, and then their response as it relates to what you all do in the legislative body. The first point is the public health department has clearly avoided some facts that have been available to everybody for at least several weeks. All right, these are CDC facts that if the public health department had paid attention to them, we would have been out of this mess weeks ago and everybody would be back to work today. Number one, people below the age of 65, when they contract the virus, are not going to the hospital. All right, according to the CDC, 10% of everybody under the age of 65 that contracts the virus does not go to the hospital. All right, they are not stressing the healthcare system. Okay, those are working people and kids, school-age kids, working folks, okay? They get the virus, they don't get sick enough to go to the hospital. That's fact number one. Number two, fact two, the number of people in that group, healthy people under the age of 65, right? The people that drive the economy, the people that the kids that go to school and need to be socialized and learn, the number of those people dying from this virus is so low, it's statistically zero. All right, it's statistically zero. It is so low. So I need to understand from the public health department why we are still shut down. Granted, there is some relief today, but I'm not optimistic about where they're going. Okay, I need to know why we are still in this position when for at least 3 weeks it has been known that working age people don't go to the hospital and they don't die. So why can't those people go to work? Okay, that's what I want to know. The second thing is, while it sounds like the health department has the right to impose civil, criminal penalties and fines, maybe that's in dispute, I don't know. Clearly, the public would be more open to their orders and more willing to pay attention to them. And by the way, I understand you're optimistic about not having to impose or to prosecuting these people. Our patience is not limitless. Okay, we are near the end, and we are running out of patience. And you will prosecute because people are not going to abide by this much longer. Okay, so I appreciate your optimism, but you need to be real about it. We would be much more willing to support their orders if they did it in conjunction with the legislative body. If there was some cooperation and a unified front with the people that we've elected, who are accountable to us, by the way, and the health department is not accountable to us, then we would feel a lot better about the source of the order and the reasoning behind it. And frankly, we don't feel that way because we feel like they're operating in a vacuum and they're not listening to anybody. And we're out of patience. And I appreciate all that you are doing here. I think this ordinance is well received and well intentioned, and I think it's totally the right thing to do, and I support it.
Thank you, Scott. Appreciate your comments.